Hi. Now today I am going to discuss with you guys regarding the growth hormone, right? I'll tell you what is the very recipe points or the summary features that help you guys in understanding the basic view or the basic things regarding growth hormone. Growth hormone. It is derived from anterior pituitary. It is an anterior pituitary hormone, right? Anterior pituitary hormone. It is also known as somatotroph, right? Now, somatostatin. This will keep the growth static. Growth hormone is related to the growth. It keeps the static growth. And somatomedin, it will mediate the growth. Right? It is secreted in pulsatile fashion, right? It is secreted in pulsatile fashion. Its secretion now increase and decrease secretion. Its secretion is increased and decreased. Its secretion is increased in. These are the very key features that will help you in solving the MCQs or to get the basic. It is increased in deep sleep. The first 2 hours of deep sleep are very important. The growth hormone is increased, right? And it is increased in puberty, right? The features where it is decreased in obesity. It is decreased in pregnancy. It is decreased by somatostatin, already discussed above, or somatomedin. Now we will learn the action of growth hormones on proteins. What is the action of growth hormone on protein? The action of growth hormone on protein is anabolic action. Anabolic. What is meant by anabolic? It means it forms the synthesis of protein and store it, right? Synthesis of protein plus store the protein, right? Store of protein in the muscle and increase the lean body mass. The effect of growth hormone on fats. It is not anabolic, but it is catabolic. It increases lipolysis, right? The increased lipolysis, there is a formation of fatty acid plus glycerol. When it led to the lipolysis, fatty acid plus glycerol. There is increased fatty acids. It means increased ketoacidosis, increased ketone bodies. When there is an increased fatty acid in the blood, there is a down regulation of insulin receptor, right? In decreased uptake of glucose in cell, increased glucose in the blood, the diabetogenic effect. It gives the diabetogenic effect, right? When there is an increased fatty acid, there is a ketoacidosis, and in this condition, there is a down regulation of insulin, right? Fatty acids, remember this fact is very important. Increased fatty acids in blood, it led to the down regulation of insulin. Down regulation of insulin, right? Remember this factor. There is a down regulation of insulin, decreased uptake of glucose in the cell, increased glucose and led to the diabetogenic. It's also known as diabetogenic effect. So, effect of growth hormones and fats are diabetogenic. When there is an increased fatty acids, there is decreased insulin secretion or down regulation of insulin. So there is an increased number of blood glucose in the there is increased number of blood glucose, right? Now there is left the effect of it on proteins and carbohydrates. Carbohydrate effect is very positive. It is anabolic, right? Store carbohydrates and increase in construction. Store carbohydrate, right? Now we have studied the effect of growth hormones on proteins, fats and carbohydrates. Now remember the effect of growth hormones and proteins are anabolic, like it is a positive, it led to the increased formation and storage, and in fat with lipolysis there is increased fatty acid. When there is an increased fatty acid, there is a decrease insulin secretion or downregulation of insulin secretion, and there is an increased number of glucose in the blood, and they led to diabetogenic effect, right? And in carbohydrates also anabolic effect. Now these are all the effects that are directly acting, right? Protein, growth hormone come act on protein, growth hormone act on fat, and growth hormone act on carbohydrates. Now there is an indirect effect of growth hormones on bones. What is it is why growth hormones have indirect effect on bones. It means that to affect on the bones, growth hormone first want the enzyme that is present in the liver, that is somatomedine, right? Growth hormone first go into the liver, then release somatomedines, and then perform the action on the effector side. That is, somatomedines are insulin-like growth factors, right? Now the action on bone is indirect. Action on bone is indirect. To act on the bone, first growth hormone goes into the liver, led to the release of somatomedines that are also known as insulin-like growth factor. Insulin-like growth factors, right? And then these growth factors they act on the effector side of the hormone, right? This is the indirect mechanism of growth hormones. Now, what is the action of this growth hormone on bones? It increases the protein synthesis at the chondrocytes. So this led to the increased linear growth, right? This is the fact number one. Number second effect of growth hormone on bones, it increased the protein synthesis in muscles and increase body mass, right? Number third effect is increase protein synthesis in most organs and led to the increased organ size, right? This is all for the bone. Now the summary, I'll give you the summary. Summary is growth hormones released from the anterior pituitary. We have somatostatin that keeps the growth hormone static, somatomedines that mediate the growth, right? The action is it keeps on coming out in a pulsatile fashion. The growth hormone increases in exercise, deep sleep, and puberty, while it decreases in obesity, pregnancy, and somatostatins. The action of growth hormones on proteins is anabolic. It led to the formation of proteins and store it. Whenever we want protein, it comes. Fat lipolysis, there is a breakdown of fats led to the formation of fatty acids and glycerol. When there is an increased fatty acid, there is a down regulation of insulin that led to diabetogenic effect. Carbohydrate is the anabolic effect. It stores carbohydrate. These all are the effects that act directly, direct effect of the growth hormone. There is an indirect effect of growth hormone. When growth hormone have to act on the bones, it has to first go into the liver, then there is a release of somatomedines, that is insulin-like growth factors, then it act on the effector organ. The effect of growth hormone is it increases protein synthesis as a chondrocyte that increases to linear growth, and its effect on muscle is increased body mass by increasing the protein synthesis, and in effect on the organs, increased organ in size by increased synthesis. This is all for the growth hormones. Thank you.